Hello, and thank you for joining us for demystifying the pharmacist patient care process, also known as the PPCP, and introduction for preceptors. My name is Kenneth Homeyer. I am an associate professor in the Department of Clinical Pharmacy here at the University of Tennessee Health Science Center College of Pharmacy. Also joining us will be Dr. Krista George, an associate professor in the Department of Clinical Pharmacy and Translational Science as well. The objectives for today's presentation include discuss the importance of incorporating the pharmacist patient care process, or PPCP, into introductory and advanced pharmacy practice experiences, or rotations. Describe the various components of the PPCP. Identify aspects of your rotation where the PPCP can be incorporated, modeled, and evaluated for students. And develop a plan for incorporating and assessing the PPCP in your practice. Your two speakers today include Kenneth Homeyer, Associate Professor of Clinical Pharmacy and Translational Science, and Krista George, Associate Professor of Clinical Pharmacy and Translational Science, both faculty within the College of Pharmacy at UTHSC. Other contributors to the program today include Kathy Krill, Director of Experiential Learning and International Programs, and James Wheeler, Director of Continuing Professional Development. To begin with the bottom line up front, we'll cut right to the chase. The reason we are talking about the PPCP, or Pharmacist Patient Care Process, is that unlike other professions, pharmacy does not at this point have a standard approach to patient care across the country and across institutions. This has led to many problems in describing what we do to external stakeholders, individuals like health systems, insurers, providers, and other payers, not the least of which are our patients, which is why we now have the PPCP, or Pharmacist Patient Care Process. So are we talking about PVC? No, those are pipes. How about PPG? No, those are paints. PCP maybe? Those are physicians. No, what we are referring to is the Pharmacist Patient Care Process. And just like we showed you several different types of logos and images which sort of called to mind the abbreviation that we just spoke about, I would like each of you to think about this wheel every time we discuss PPCP. The PPCP is a process, and that process never ends. It begins at the very top with collect. From there, we assess. We then plan, implement, follow up, and monitor. And once we've followed up and monitored, we begin the collection process again. All of these steps are integral to patient care and are all centered around collaboration, proper communication, and proper documentation. We'll go through each of these steps individually and describe how they apply to practice sites like yours in a few moments. We have two very simple objectives for today's presentation. The first is to describe the various components of the PPCP. Our second objective is to identify aspects of your rotation that can utilize PPCP. So one may ask, why should I care about the pharmacist patient care process? What I've been doing has been working, and I've been doing it for some time. Well, we're going to offer three main reasons why a preceptor should care about the pharmacist patient care process. Reason one, our patients do not understand what we do. Ask 10 pharmacists and get 11 different responses. This presents an ununified message for the profession. Whereas if one was to look at a dentist, an optometrist, or other health provider, a patient or other stakeholder may be able to readily describe what it is that they do on a daily basis. Number two, our payers and legislators do not understand what we do. Questions currently being asked include, how do we ensure consistent quality across institutions and pharmacies? How do I know what I'm paying for as a payer or a health insurer? And what is it that a pharmacist does outside of dispensing? Again, these are not theoretical questions. These are questions being asked of our national pharmacy associations, organizations, and other large national pharmacy groups as we continue to move towards provider status and advanced levels of care. And lastly, accreditation requirements. The PPCP and use of PPCP in training and educating student pharmacists is a requirement of preceptors of students of pharmacy. So, how did we get here? Well, we can rewind all the way back to 1990 or so with the introduction of Hepler's and Strand's pharmaceutical care model, which was a single unifying model for pharmacists provided patient care. As the years went on and new opportunities arose, varying and unique approaches began to be taught and utilized across institutions and centers of learning. These include acute care approaches, medication therapy management specific approaches, College of Pharmacy specific approaches, and institution or organization specific approaches. In other words, a hospital practicing pharmacy in Memphis, Tennessee may look very different from a center in Fresno, California, because there was at that point no unifying definition in place. Fast forwarding to 2014 was when the introduction of the pharmacist patient care process occurred as a means to get us back to a single model, a single definition, and a single approach to delivering pharmacist-provided patient care. As stated in the executive summary of the Pharmacist Patient Care Process White Paper, the profession of pharmacy is continuing its evolution from a principal focus on medication product distribution to expanded clinically oriented patient care services. As a result of this professional evolution, the importance of and need for a consistent process of care in the delivery of patient care services has been increasingly recognized by the profession at large. To put this simply, we are looking for brand recognition. If I display the image on the left-hand side of your screen, immediately what would come to mind is Apple. You may think high-quality products. You may think innovation. You may think your cell phone or the cell phones of those around you because of its popularity. But in either case, a simple image brings to mind something that we can all agree on because of brand recognition. Another example, the Mercedes-Benz symbol, may bring to mind different ideas in your mind. It may represent an expensive car. It may also represent innovation. It may represent German engineering, or a dream car that you want to own someday. In either case, the same thing is true. A single image represents a concept in our minds with little thought. As we look at pharmacist-provided care, this is the sort of model that we want our patients, stakeholders, payers to think of when they think of pharmacists. Consistent quality and a consistent message. Importantly, the PPCP definition and its use is part of a broader collaboration and consensus between multiple stakeholders within the profession of pharmacy. Associations like AACP, ACCP, ACPE, ASHP, and APHA, among others, have all endorsed the use of PPCP, making this truly a profession-wide definition. Some frequently asked questions that you may be thinking to yourself right now include, is PPCP something new I need to add? No. In reality, you're already teaching it and likely already doing it. What we are asking for is a standardized language to be used across all 4 years of the pharmacy education. As our students go into practice, they will then be able to converse in a general vocabulary around patient care across institutions, states, and eventually countries. Where does this fit into my rotation? Well, if you are discussing a patient or asking the student to apply knowledge, then PPCP can fit in. Do I always need an activity to assess the student? No. Although assessment is important, the PPCP can also be used to teach material as it provides a framework to discuss important teaching points. In summary, PPCP is new language, but it is not a new service that you would add to your site. It fits into your rotation anytime you're discussing a patient or asking the student to apply knowledge. And lastly, there is no need for formal assessment every time PPCP is used. As you are discussing a patient case, you may also use PPCP as a framework to use as you are describing the approach that you have used in working up and taking care of that patient. So we'll begin talking about some practical implications of PPCP in a moment to help you visualize where this fits into your practice site. But let's begin first by talking about where does this fit in? Well, it applies to a wide variety of patient care services provided by pharmacists and the pharmacist medication expertise. The level of intensity may vary depending on the service and the location, and one pharmacist might be responsible for all of the steps in some settings, where in others, more than one pharmacist may be involved in different stages of the process. In other words, one pharmacist may collect and assess, another pharmacist may develop the plan and implement, and lastly, another pharmacist may follow up, monitor, and begin the collection process again. And where does this fit? Well, it fits across any setting where a pharmacist provides care. That can be an acute care setting, ambulatory care, community, and the list goes on. If a pharmacist is involved in direct patient care, they have the ability to use the PPCP.
Pharmacists use a patient-centered approach in collaboration with other providers on the healthcare team to optimize patient health and medication outcomes. An essential first step in the process is the establishment of a patient-pharmacist relationship that supports engagement and effective communication with patients, families, and caregivers throughout the process. Additionally, at the core of the process, pharmacists continually collaborate, document, and communicate with physicians, other pharmacists, and other healthcare professionals in the provision of safe, effective, and coordinated care. The first step in the PPCP is to collect. The pharmacist assures the collection of the necessary subjective and objective information about the patient in order to understand the relevant medical and medication history and clinical status of the patient. Next, the pharmacist assesses the information collected and analyzes the clinical effects of the patient's therapy in the context of the patient's overall health goals in order to identify and prioritize problems and achieve optimal care. The next step in the process is to plan. The pharmacist develops an individualized patient-centered care plan in collaboration with other healthcare professionals and the patient or caregiver that is evidence-based and cost-effective. Next, the pharmacist implements the care plan in collaboration with other healthcare professionals and the patient or caregiver. The last step in the process is to follow up, monitor, and evaluate. The pharmacist monitors and evaluates the effectiveness of the care plan and modifies the plan in collaboration with other healthcare professionals and the patient or caregiver as needed. Next, we will look at two examples of how the pharmacist patient care process can be used in a community pharmacy to teach an APPE student. The topic of this intervention is statin non-adherence. First, the pharmacist collects the following information. A 55-year-old male presents with adherence to statin therapy less than 50% of the time, and adherence to allergy medication greater than 90% of the time over the past 6 months. Copays for both medications are less than $5. The pharmacist makes the assessment that, depending on the patient's financial means, the cost may be prohibitive. Also, the patient may not realize the need for statin therapy. The pharmacist creates the plan to have a brief intervention with the patient and determine the cost versus the importance of statin therapy for the patient. The pharmacist decides the best way to implement the plan would be to place a telephone call to the patient. Finally, the pharmacist decides that the follow-up will occur in the next month during refill pickup to monitor for adherence. Where does this PPCP example take place? In the regular workflow of the community pharmacy. The teaching method used for the APPE student includes an informal discussion of the intervention and the plan at the time of care. Remember, you don't have to make a formal assessment of how the student participates in the PPCP process every time. Pharmacist makes a note in this situation to have the student make the intervention for the patient. In our second example, we'll follow up with our statin non-adherence patient. The pharmacist collects the following information. During the telephone call, the patient states they have begun a quote-unquote OTC statin called fish oil, and now the patient takes this to prevent a second heart attack. The pharmacist then makes the assessment that fish oil may be beneficial, but the patient is still missing a 5% absolute risk reduction in cardiovascular disease by not taking statin therapy. The pharmacist comes up with a plan to explain the concept of risk to the patient and discuss additional benefits of statin therapy. To implement the plan, the pharmacist will have an in-person conversation when the patient returns to pick up their allergy medication. The follow-up plan will be in 1 month to ensure adherence. This also takes place after the initial telephone conversation with the patient in the normal workflow of a community pharmacy. To teach this method, the pharmacist could give homework to the student, have them research the benefits of statin therapy versus OTC fish oil in terms of cardiovascular risk reduction. The student could then present this the next day. The pharmacist would assess the student giving verbal, formative feedback on the use of the PPCP. The pharmacist also notes that the student will make the intervention with the patient.